Hi and welcome. My name is Danielle and I will be your voice and companion throughout this course. In this video, we will discuss the basics of oral PrEP. We are sure that you will find this online course informative and that it will assist you in preparing for the few certification questions as well as the final assessment at the end of the course. You will need to watch the video and then answer some checkpoint questions at the end thereof. Remember, you can watch the video as many times as you need to. You will have 3 attempts to pass this final assessment, and the pass rate is 85%. Once you have passed the final assessment, you will be issued with a certificate of completion for the course. Your certificate will be emailed to you. If you are unsuccessful after your 3rd attempt at the final assessment, your course will be reset and you will be able to try again. We hope that this course will contain everything you need. Good luck and have fun with your learning. Let us begin by discussing what oral PrEP is. Oral refers to the method with which this medicine is administered, which is orally. PrEP stands for pre-exposure prophylaxis. Pre meaning before, exposure referring to exposure to HIV, prophylaxis meaning prevention. Prophylaxis is the provision of medications prior to a germ or virus exposure to prevent infection. PrEP is an oral medication that can be taken by an HIV-negative person to prevent contracting HIV. Oral PrEP is a single fixed-dose combination of 2 antiretrovirals, namely tenofovir, or TDF, and emtricitabine, otherwise known as FTC. Oral PrEP should be taken daily in order to provide maximum protection from HIV. Oral PrEP is not intended as a lifelong intervention, but rather should be used for periods in one's life when one feels at increased risk of HIV. Current South African guidelines recommend 7 days of daily oral PrEP build-up to reach a maximum drug levels of protection before a potential exposure. The guidelines also recommend continued use for 28 days of PrEP after an exposure in order to be fully protected. We recognize that most people cannot plan for all life's incidents, accidents, and happenings, specifically and accordingly, and therefore we recommend using oral PrEP during periods in one's life when one may be at risk. We call this seasons of risk. For example, a young woman who studies in an urban city but lives outside the city. During the 9 months of the year when she's attending classes and has multiple partners, she may feel at risk. However, at the end of the year when she returns home, she may stop using oral PrEP for those periods she is not at risk. The World Health Organization recommends that oral PrEP containing tenofovir should be offered as an additional prevention choice for people who are at substantial risk for HIV as part of a combination prevention. They define substantial risk as a population group with an incidence of HIV infection of about 3 per 100 person years in the absence of PrEP. This can be based on the epidemiological context or on an individual risk assessment. The combination of tenofovir and emtricitabine has been chosen for oral PrEP because high efficacy was demonstrated in both preclinical and clinical studies, with high concentrations of these found in both the genital tract and blood. Oral PrEP is a safe medication with mild side effects and is very well tolerated. Lastly, it only requires 1 tablet a day, which can be taken with or without food. But more about this later. PrEP is not intended to be used as a standalone intervention, but should rather be used as part of a combination HIV prevention in the context of SRH service delivery. Other examples of HIV prevention that make part of the combination prevention package includes condoms, pre-exposure prophylaxis, counseling, post-exposure prophylaxis, following a healthy lifestyle and getting tested regularly for HIV, screening for and treating sexually transmitted infections, voluntary medical male circumcision, knowing your partner's status, and if your partner is HIV positive, getting them on treatment and virally suppressed. It is important that PrEP is provided as part of a comprehensive package. PrEP may not be the ideal option for everyone, and so marketing it as a be-all and end-all product can be harmful for people who may not choose to use it. Remind people that they have other options to use together with or instead of PrEP if they so choose. It is important to remember that PrEP only protects you from HIV and does not protect you from other STIs or pregnancy. So why is TDF and FTC specifically used for PrEP? High efficacy was demonstrated in both preclinical and clinical studies, with high concentrations of these found in both the genital tract and blood. Studies have also shown that tenofovir and emtricitabine combination has a favorable safety and tolerability profile. It is considered convenient as only one tablet is required to be taken per day and can be taken with or without food. You may be wondering what is the difference between oral PrEP, PEP, and ARTs. Antiretrovirals are used both to treat and prevent HIV, and often the same medications are used for both. This has caused some confusions with regards to what the differences are between PrEP, PEP, and ART. We will now go through what the main differences are between these three. Firstly, oral PrEP, as mentioned previously, is short for pre-exposure prophylaxis. It is the use of ARVs taken by HIV-negative people before an exposure to HIV. It is a tablet that should be taken daily during periods of risk to prevent HIV acquisition and is not intended to be a lifelong medication. South African guidelines recommend using it for at least 7 days before an exposure and 28 days after your last potential exposure in order to be optimally protected. PEP is post-exposure prophylaxis. This is the use of ARVs given to HIV-negative individuals after an exposure to HIV. For example, a burst condom, after sexual assault, or after needle stick injury by people who inject drugs or work in the medical profession. This medication is taken after an exposure, but in order to be effective, it must be given within 72 hours after an exposure. It is also taken daily and must be continued for 28 days. It is a combination of 2 or 3 antiretrovirals. Lastly, ART is given as treatment for people who are HIV positive. It is given to HIV positive individuals in order to minimize the effects of HIV, strengthen their immune system, reduce their viral load, and increase their CD4 count. It is used daily and is intended as lifelong treatment. In South Africa, we use a combination of 3 antiretrovirals to treat HIV. It is important to be able to distinguish between these 3, as all 3 use antiretrovirals, but their purposes are very different. We will now dive a little deeper into how oral PrEP works to prevent HIV. As we have mentioned previously, oral PrEP is a combination of 2 antiretrovirals, tenofovir and emtricitabine. So in short, when HIV enters a healthy T cell, it attempts to make copies of itself using an enzyme called reverse transcriptase. The NRTIs, tenofovir and emtricitabine, block this enzyme, preventing HIV from making copies of itself. By getting high levels of oral PrEP in the bloodstream, rectum, and vaginal tissues, you can prevent HIV from entering, replicating itself in the T cells. Let's have a look at how reverse transcriptase works in action. The HIV virus attaches to the surface of the CD4 cell. HIV proteins and enzymes are released into the cell. Reverse transcription produces a double-strand HI virus. Integrase enables HIV to link into the cell's DNA. Protease cuts and reassembles the new HIV. Each cell produces hundreds of new virions. Oral PrEP blocks steps 1 to 3, preventing the HI virus from attaching to the surface of the CD4 cells and the subsequent production of the double-strand HI virus. Okay, grab a pen and paper and let's summarize what we have just discussed. PrEP stands for pre-exposure prophylaxis. It is used to protect an HIV-negative person from acquiring HIV. Oral PrEP is a combination of 2 antiretrovirals in a single tablet fixed-dose combination. It is a daily tablet used for as long as you feel that you are at risk and should be provided within the context of a combination HIV prevention package and SRH services. It does not protect against pregnancy and STIs. The screening process entails following the oral pre-exposure prophylaxis algorithm. There are 5 important tests to do before initiating someone on oral PrEP, namely an HIV test, renal function, hepatitis B, screening for STIs, and pregnancy tests. We recommend same-day initiation, but if that is not possible, initiation should happen within 1 month of screening. For same-day initiation, you will have already done the HIV test, assessed the risk, and conducted risk reduction counselling. You will also have done all the other screening procedures that day. You will dispense PrEP the same day after doing the following: providing combination prevention, as we spoke about earlier, including condoms, STI screening, pregnancy screening, provision of contraception, and providing other methods of HIV prevention. You will educate the client on important points, including side effects and practicing effective use, and ensure that all their other SRH needs are met. Lastly, you will prescribe PrEP as a combination of TDF 300 mg and FDC 200 mg in a fixed dose combination tablet per us daily for 1 month. At this visit, you will provide a script for 1 month's worth of PrEP and give the patient 1 month's supply. You will then give the patient a follow-up date for 1 month's time. If you do not do same-day initiation, you must initiate the client on PrEP within 1 month of screening. Initiation within 1 month of screening the patient is important because the other test results will still be relevant. However, you must still repeat the HIV rapid test. Other important information the client may need. Note that in the bottle, there are usually 28 tablets per bottle for 28 days of oral PrEP usage. Patients need to be reminded to store the drugs at room temperature and not put it in the fridge or store them in the sun at home. That was an enormous amount of information, but it basically boils down to the fact that there are 5 important steps in clinical screening. You have to test for and be sure to exclude HIV. You must test renal function with the creatinine clearance test. You have to test for hepatitis B. You must screen for STIs. And lastly, you need to perform a pregnancy test. Same-day initiation is encouraged, but if that is not possible, be sure to initiate the patient within 1 month. At that visit, confirm eligibility, repeat the HIV test, provide combination prevention, counsel the patient effectively, and script and dispense 1 month supply of oral PrEP. There are 28 days worth of PrEP medication per bottle, and remember the bottle should be stored at room temperature. PrEP should be taken daily. It takes 7 days of continuous use to build up an effective concentration and should be taken for 28 days after the last exposure. PrEP is not intended to be a lifelong medication, but should rather be used during seasons of risk. PrEP does not interact with contraception, STI medication, or alcohol. Patients should be encouraged to still use condoms, as PrEP is not 100% effective and does not protect against pregnancy or STIs. The important messaging with relation to the side effects is that overall, oral PrEP is a very safe medication, and 90% of people will not have any side effects when using oral PrEP. Those few who do experience side effects only suffer mild or minor side effects that are self-limiting and easily treated. Typically, these side effects only last a few days after starting oral PrEP. Common side effects include headache, gastrointestinal symptoms, namely nausea, vomiting, constipation, or abdominal pain, as well as the loss of appetite. It is very important to warn patients of the potential side effects, but more importantly, to tell them that they are mild and self-limiting, and that they will not cause permanent damage and can be easily treated with common medications. There is not very much to summarize about the side effects of oral PrEP because there are so few of them, but let's give it a go. Side effects are uncommon, only 1 in 10 will experience them. Side effects are mild and self-limiting. It is important to both counsel patients and provide symptomatic support. In terms of PrEP monitoring, the schedule is relayed as having a follow-up visit 1 month after initiation and then every 3 months thereafter. Note, every 3 months is a clinical visit where the patient is required to see a clinician, a nurse or a doctor. At these visits, patients will get 3 months worth of PrEP scripted, but will only be given 1 bottle of oral PrEP per month. They will be required to pick up their monthly supply for PrEP every month. Let's just summarize real quick. Oral PrEP schedule. Initiation, month 1, month 4, month 7. Every 3 months are clinical visits. Test for HIV at every clinical visit. Test renal function at initiation and 6 months later, and annually thereafter. Remember, young people may not stick to their schedule. Try to be flexible. Stop PrEP if a patient seroconverts or if their creatinine clearance drops to less than 60 ml per minute, or if the patient chooses to. Cycling on and off oral PrEP is not considered non-adherence, since oral PrEP is not intended to be a lifelong medication.
And now it's time for our final summary of this course. I will try and keep it brief and simple. Oral PrEP is a tablet that we give HIV-negative people in order to protect them from HIV. It is a combination of 2 antiretrovirals, namely tenofovir and emtricitabine. Oral PrEP is safe and has very few side effects that are easy to manage. Use of oral PrEP requires kidney function monitoring, and remember that oral PrEP does not cause resistance. Oral PrEP should be provided as part of a combination prevention package and should be taken daily to ensure high levels of protection. Oral PrEP is not intended as a lifelong medication and should only be used for periods in one's life when one feels at increased risk of HIV. It is safe to cycle on and off PrEP.
You did it. You reached the end of this course. Now you need to answer the questions as well as the final assessment at the end, the results of which will determine if you will be issued with the certificate of completion. Thank you for your time and effort, and good luck with the last step of this training process.